Afternoon, and thank you for joining us. At 7 a.m. this past Tuesday, I received a call from Tennessee Department Health Commissioner Lisa Piercy. And at 10 a.m. yesterday morning, the city of Memphis accepted responsibility and accountability for the inventory and distribution of vaccines. As you can imagine, the rest has been a whirlwind. But when you really think about it, how many weeks this past year haven't been like that? I want to be clear. Our new role in the COVID-19 vaccination process is strictly about distribution. The county health department is still in charge of public health decisions, such as whether we should move from one phase to the other, and they are in charge of all other kinds of vaccinations. I want to publicly thank the county health department and Mayor Harris for working so closely with us the last 2 days through this process. Excuse me. This morning, the Memphis Fire Department and other partners successfully withdrew and transported 6,750 doses to 8 locations across our county to administer today: Appling, Germantown, Raleigh, Whitehaven, Pipkin, the Shelby County Health Department's commodities site, and 2 points of distribution for Shelby County schools. All these sites are well underway this morning and started on time with minor interruption. We are living in unprecedented times, and everyone is trying to work through this as quickly and efficiently as we can. To be honest with you, it's a little like jumping on a moving train, taking over as conductor, and learning how to drive all at the same time. That said, I want to reassure everyone that we have a plan and the right people in place, and we're working hard to implement that plan. Almost every city division has been involved in the last 48 hours: fire, general services, IT, police, legal, libraries, HR, finance, and executive. And I want to thank them all. For the remainder of this week, we will be following the same schedule as previously publicized. From the public's standpoint, citizens will not need to do anything differently. For next week, we are in the process of working on a plan for the appointment schedule. We are planning to administer roughly 17,000 first doses and almost 13,000 second doses Monday through Saturday next week. Citizens should continue using Sign Up Genius for the time being, and a link can be found on covid19.memphistn.gov and on shelby.community. We are working with Shelby County and the Health Department so that 222 SHOT is still the number to call to schedule your appointment if you don't have internet access. To close out, I want to reiterate that Shelby County is still our partner in this fight and will remain a part of the joint task force that I co-chair with Mayor Harris. As I've said for the entire pandemic, it will take all of us, government, private business, and all citizens working together to get through this. And we have every intention of continuing along that line. Doug McGowen will now speak and give more details, particularly on the last 48 hours and the transition.
Thank you, Mayor. Appreciate the opportunity to be back with you all from our studio here after an absence because of the weather, and good to share some information with you. Mayor talked a little bit about the transition, and I think it's important that all of you know who's involved from an accountability perspective. I have offered and the mayor has accepted my role as the accountability partner for the vaccine program here with the city of Memphis. So I'm accountable for the inventory, the successful distribution, as well as the performance of our teams. That is how long you have to wait in line and also the performance of the scheduling system. To ensure that there's continuity, I've asked the fire chief, Gina Sweat, to be my deputy in that role so that there's absolutely no loss of continuity in the event that I can't be present one day, and she is doing a wonderful job at that. We have 3 other individuals who are key to this process who are also going to be involved. First, we need someone who every day thinks only about the vaccination inventory and the distribution to the sites, and that is Deputy Chief Angie Shelton with the Memphis Fire Department. We also have a lead for the planning of the distribution, the appointment system, and ensuring that people have access through the phone and or the internet to their appointments, and that is Battalion Chief Jason Stewart. And the third lead person, many of you have seen her in action already, is Tiffany Collins, the Deputy Director of General Services. She is responsible for day-to-day operation in all of the public pods to ensure that they have the resources they need to be successful in delivering a high volume of vaccines. So that's who's involved from the city side, and you'll look to see more updates from us. As the mayor said, it's been a busy 24 hours, transitioning what is a demanding, detail-oriented, heavily accountable process of accepting vaccinations from the federal government, keeping accountability of those doses as they go out to the sites, and putting a distribution plan in place is a gargantuan task, and one that we are very thankful for our partners at the Shelby County Health Department and the government of Shelby County for helping us to have a seamless transition. As the mayor said, it was 10 o'clock yesterday morning when the switch was thrown, and this morning at 8 o'clock we were able to have successfully a seamless transition and doses actually being administered at all of our sites by 9 o'clock this morning. There is a process that is in place and that we have had in place. I think it's important for people to understand about how do we decide where the doses go. Well, the state of Tennessee tells us each week how many we should expect to receive. And so for next week, they told us we're going to receive 13,700 first doses and 12,870 second doses. Yesterday afternoon, a collaboration of the hospital systems, all of the federally qualified healthcare clinics, such as Christ Community and Church Health, along with the hospital systems, Shelby County Health Department, and all of the pod leaders for the public pods, came together and decided on an apportionment. So how many will be at the pods next week, how many will the hospitals receive, and how many will the FQHC clinics receive. We sent that to the state, and then the state approves that process, and that is what we base next week's appointments on. When we receive that quantity back from the state, we can now open up schedules and the detailed process of each day's scheduling. First dose, second dose, and type of dose happens. So that process is well underway. We had started that actually last week, and this week we refined that process. I also want to thank everybody who was involved in making today happen. I mentioned very briefly that we flipped the switch at 10 a.m. and this morning we pulled vaccine from vials to put into arms. There's a lot that happens in between there. Our partners at Regional One Health provided a brand new access to a freezer and refrigeration system at their hospital. Doses were transferred from the Shelby County Health Department storage unit over to Regional One's storage unit. That happened last evening, and it was completed at 10 p.m. In order for these Pfizer doses to be delivered to the public, they are very sensitive to temperature. They're stored at 70 to 80 degrees below zero. Then they are thawed and maintained at a very accurate temperature between 2 and 8 degrees Celsius. They have to stay at that temperature all throughout the distribution system. In order to do that, there are coolers. The brand name is AccuCold. There are others. But when it is taken from the pharmacy, placed into the cooler, that cooler is then plugged into a vehicle to maintain the temperature, taken out of the vehicle, plugged in at the site, and temperatures are monitored each and every hour throughout the day. 5 degrees Celsius is the target, but to have those systems in place to maintain that temperature is critically important. Yesterday at noon, the city of Memphis had 0 AccuCold coolers. Last night by 6 p.m., the city of Memphis had 15. Our partners at Shelby County provided us with 7 that they had. The state of Tennessee flew in via Black Hawk helicopter 8 AccuCold coolers that they had in other parts of the state. And so by the end of the day, we had all the tools that were necessary for us to deliver the vaccine this morning. It is a complex process. It is one that we are earnest about getting right. It's one that I'm accountable to all of you for executing, and we take that responsibility very seriously. And we aim to continue, as I said, delivering doses. David Sweat will tell you how we've done so far. I know we're north of 100,000. David, you'll give us the specific number. And the numbers, he will also talk about where we are going with the infection rate. Things are moving in the right direction. The work of the this task force for the last year has been, I think, nothing short of phenomenal to keep this pandemic at the levels that they have been. We are succeeding where other communities have not had as much success, especially with our death rate, with our rate of testing. And now with this vaccination program, we anticipate we will again be a leader in that regard as well. So I'll turn it over to David, and then we'll come back and take any questions that you might have. David Sweat.
Thank you, Chief McGowen and Mayor Mayor Strickland. David Sweat, Deputy Director, Shelby County Health Department. Happy to be with you here today to give you an update on the progress of the epidemic in Shelby County. What was referenced is true. We have had, first of all, we have performed in Shelby County 1,012,618 COVID tests during this pandemic. That's an astounding number. There's certainly more than enough testing has occurred in this community for every single person to have been tested, even though every person hasn't been tested. But the testing effort has been one of the resounding successes of the Joint Task Force response. We have had over 100,000 of those tests, or 9.9% of the million tests have come back positive. And that has led to, in Shelby County, 87,449 persons being diagnosed with COVID-19 disease. And we've had 1,479 individuals who have died. In terms of new cases, since yesterday, we had 220 new cases yesterday. And as we saw from the winter storm, there was a suppression of people going out and about and being tested, but this week all of the test sites are back in full operation. And as we warned last week, we wouldn't be surprised if this week we saw an increase again in the number of cases detected, because testing has rebounded. And we did have 220 new cases diagnosed yesterday. So although the numbers are very good, and although all the trends are going in the right direction, we are certainly not out of the woods yet. We do have some good news, though. As far as the reproductive rate of the virus, it's at 0.73 and has been below 1 since January 1st. So throughout 2021 so far, we have been shrinking the future epidemic. Each case is producing less than 1 new case in the future. That's an incredible track record of success in the community, and thank you to all of you who have adhered to social distancing and worn your mask and done all the things we've asked you to do to help us reduce the spread of the virus. As far as other important numbers for the state of Tennessee, 768,946 cases have been reported so far. And in the surrounding counties, 6,896 cases were reported in Tipton County. We've had in Fayette County, 4,637 cases reported so far. Crittenden County, Arkansas, 5,278 cases, and in DeSoto County, Mississippi, 19,515 cases have been reported so far in the epidemic. Now, our test positivity rate right now is 6.6%, so we're in single digits. That number had dropped to about 6.3% toward the end of last week, so it's up a little bit right now, but still in a very good place. Our case rate per 100,000 is less than 12 cases per 100,000 that are being diagnosed, and all the counties in the Mid-South have similarly low case rates per 100,000. So as Chief McGowen mentioned, the numbers are going in the right direction in many aspects. As far as the vaccine campaign totals, 79,423 people have been vaccinated with at least one dose. 35,052 people have received both doses in Shelby County, and we are at 12% of our vaccine campaign target goal for the number of people that we need to vaccinate in Shelby County to reach the tipping point of where we would say an acceptable number of people have been vaccinated to protect the entire community. That is called herd immunity. So we are not there yet, but we're 12% of the way there and committed to helping us get the rest of the way there. So with that, I will turn it back to Chief McGowan.
Thank you, David. Certainly good news with the numbers. Thank you for that. We'll open it up for questions now.
Dominique Dillon, Fox 13.
Hello, can you hear me?
Yes.
Yes.
All right. Well, my question is, one, what was the plan for the teacher vaccinations, including the schedule? And did anyone request for the health department to hold back vaccines?
Well, I will address the first. I don't have any information on the second, but the first request today, well, this week, Wednesday, Thursday, and Friday, we're providing about 6,000 vaccines for Shelby County and all of the charter schools, and that represents the population who has agreed to take the vaccination. So we will, at the end of this week, be complete with the first round immunizations for Shelby County and the charter schools. Later this week, on Friday, we'll be providing approximately 1,500 vaccinations for the schools in the Bartlett area and the Arlington area, and that will be sufficient to complete their first round vaccinations. The Collierville and Germantown schools are working with the Collierville-Germantown pod, and next Friday they will receive approximately 1,400 vaccinations so that they can get their first rounds completed. And then the municipal schools and the the independent schools in the Catholic Diocese have partnered with several of the healthcare systems to deliver vaccines to their teachers. So between the end of this week and the beginning of next week, all of the teachers in the area, with the exception of one or two systems who we are reaching out to and working with, we think there's about 1,000 more doses we'll have to do to reach all of the teachers. We anticipate trying to get that done in the next week or two.
And my final question, have doses been held back for any other subsets? And did you ask for help when it comes to distribution from the state? If so, when?
Okay, so that's a health department question. I know I have no information about requests for anything being held back. I will say with the state, I have a continuing dialogue as a part of the task force. The Shelby County government, Shelby County Health Department, and all of our partners have a continuing dialogue with the Tennessee Department of Health and with the unified command at the state level. They came for a visit last week. They have routinely visited. They are responsive to our requests, but we did not specifically ask from the task force level for help with distribution.
Jane Roberts, Daily Memphian.
Doug, this is a question for you. Did you say that you submitted a plan to the state for the apportionment of the vaccine? Or is that plan and you're waiting to hear back?
So, yeah, that is not a new process, Jane. I just wanted you to be aware that how this works is the federal government gets a certain amount from the manufacturers. They take a request from the state every week, and then they distribute it to the states. For the state to know how much to distribute to us, we have to have a plan. So we get a percentage based on the population. So 13,700 new doses is what our allocation is for next week. That is our percentage share of the state's anticipated what they will receive next week. So in order for them to distribute it, there are about 30 agencies in Shelby County that are eligible to receive vaccine. Many of them are independent pharmacies. Some of those are branches of our healthcare systems. For instance, there are 6 or 7 Baptist facilities that make up that total. What we do is get together and we say, of the 13,700, for instance, what do we need to complete vaccination of the staff at St. Jude? what do we need to complete the vaccination of the staff at Methodist? And then for the other partners, what do we need for the FQHCs, the Christ Community Church Health, to adequately put vaccine out in the communities through their clinics, and then the balance will come to the pods. We submit that to the state. They just verify that they can meet that need. They will tell us by tomorrow afternoon that they're going to ship that amount to us. On Monday, they will put the label on the packages, and on Wednesday of next week, we will receive those vaccines.
May I ask a follow-up question? Has the proportionment, are you suggesting that it change going forward, or are you happy with the way it's been?
Could you clarify? Do you mean the amount we've received from the state or how we have allocated it locally?
How you've allocated it. Will the hospitals, for instance, be getting more, or will Christ Community be getting more?
So we have, that changes on a week-to-week basis based on the ability of people to actually, of our partners to put it out. We have, for instance, this week we have requested to increase slightly our FQHC volume. Our hospital systems, as I said, they are doing not only their staffs, but they have also made agreements with some of the school systems and other agencies to administer vaccines for them. So they make a request. 1 week, a hospital may request 2,000 doses. Another week, they may request none. We also are trying to be geographically sensitive to make sure that we reach all the demographics. And so you will see this week we have 2 pop-up pods, one on Friday and one on Saturday, that are in areas where we, health department identified we had a cohort that had a need. And so we'll continue to do that. Making sure that everyone has the ability to access this is important, both through our high volume public sites, and then as we see a need for specific areas, that's where a pop-up pod may occur. But that's how the process works, Jane.
Stacy Jacobson, WREG.
Stacy?
Stacy, I think you're muted.
Okay, can you hear me?
Yes.
Sorry about that. Okay. 2 questions. Doug, I don't know if you can answer both. I think you can answer the first. You said that the state flew in 8 of those AccuCold coolers and the health department gave y'all 7. So why did you all need to more than double the supply of those specialty coolers that you had? Did the Shelby County Health Department not have enough to be doing this adequately? And then my other question is, the health department was saying back on February 2nd that they were planning to vaccinate teachers in late February or March. So is that the stockpiling that they're talking about? And why, the stockpiling that Mayor Harris referenced yesterday, and why did they need to do that so early in the month if they were planning to not get to the teachers until later in the month or early March? And then how does that still explain why the state says that the expired doses expired as early as February 3rd? Thank you.
Okay, so that was, I think, 6 questions. I'll address the first one. So the state did a visit here, and their assessment of part of the, I think part of the improvement and part of making sure that we keep things at the right temperature was to make sure that we had vehicles, we had enough AccuColds in the vehicles to transport them to the sites, and that we also had enough AccuColds on the sites that they could maintain if we needed to transfer from the vehicle to the AccuCold on the site. And so the demand signal for 15 AccuColds was driven by the state based on our logistics laydown. And so we're thankful, and again, the health department has loaned us those. We have some on order for ourselves, so we will get up eventually to about 20 of those just to make sure we have enough in the system. So that's, I can't speak to the science that went behind that since 10 o'clock yesterday morning, but that's what we were told based on our apportionment that we would need. I can't speak to the term stockpiling. I'm not familiar. I hadn't been a part of those discussions, to be quite honest, but I'm most interested in today. We know that we had an inventory of 40,000 or so. The number's down to approximately 30,000 today. I'm interested in getting all of those out of Regional 1 Health and into the arms of Shelby Countyans, including teachers. This week we anticipate putting out somewhere between 30 and 40,000 doses, which will bring us down to the ability to accept new doses and new second doses. And then going forward, that's, once we get through this amount, next week, like I said, we're going to do about 30,000 as well. So, David, if you have anything else, I don't know if you, nothing else to ask. Yeah? Okay.
To speak to some of that
Okay.
stuff too the other day.
Sure.
You know, as I mentioned yesterday or earlier this week in another press briefing, the number of doses that we need to bring into the community will always be increasing, right? And so the numbers will keep going up because we've got the people that have previously been vaccinated and need their second dose, and we still need future first doses, right? So the number of things to transport coolers and the number of vaccines in inventory will always be pressure to go up. But right now, very happy that we've got a plan to distribute another 30,000 the rest of the week and continue the vaccine effort. But I have no information about the stockpile question to add to anything that's already been said previously.
Fred Broders, Local 24.
Good afternoon, everyone. This is a question for Doug, maybe possibly Mayor Strickland. I know these last couple of days there's been a lot of frustration from the public. Could you speak on 2 or 3 specific examples of changes made or plan to be made now that you all have sort of taken the reins primarily for the vaccine distribution for the public wondering out there? And I have a follow-up.
Okay, so let me just speak broadly that from the beginning, we have been trying to build an ecosystem of distribution so that we could handle between 30 and 50,000 vaccines a week. It has taken some time to build that up. If you recall, we started with just the Pipkin building, and then we did Pipkin and Appling, Appling in Germantown, and now we have Raleigh and we have Whitehaven. That ecosystem can distribute approximately 33,000 doses a week as it stands today. We may be able to incrementally bring that up. The hospital systems come into play here. As you heard, this coming week, they will receive between 5,000 and 6,000 doses, which ups our total volume that we can distribute, plus the FQHCs. And as you heard this week, we're doing about 8,000 for the teachers. So we have the capacity now. We've been building that. I don't want to look backwards with 2020 vision, but we have been building that over time. Some of the improvements have been underway at each of the sites already, and we're just trying to make sure there's standardization. The 2 biggest things, and I know that you've heard Mayor Strickland talk about this, that we will enforce are outside the vaccination sites. The first is that you must have an appointment before you show up. And the second is not to show up more than an hour before your appointment. And if you do, we're going to ask you to come back no more than an hour before your appointment time. That really does streamline the flow of cars in and out. I realize everybody wants to get there early, but if you look at the lines where that has been employed, the wait times are down. The average is well under 30 minutes, and the excursions on the long side are still typically under an hour, unless you arrive very early in the morning before we open, and then you may wait a little longer. So that's number 1. Number 2, that means you have to have an appointment system that meets the needs of the public. We have been doing the best that we can with the Sign Up Genius. That was a system that was offered. It is not perfect. We will be transitioning to a more robust scheduling software that will likely be in a week or 2. The state system is called VRAS, and we are working to bring that to us so that we can have a more robust scheduling system with a little more visibility, helping with scheduling second appointments, that kind of thing. The first one is very labor intensive, so that's a second improvement. And then third, we're trying to do all we can to make sure that we have a full week's schedule set out on a Friday before. We're also adding, David and I were talking about this just a minute ago, our 222 shot. It is a labor intensive, it's tough to do that call center, so we're going to add some new capacity there, more call takers to ensure that we can capture the volume of calls. So those small incremental improvements, I think, will see a broad-ranging impact in wait times and the amount of decreasing the amount of frustration with getting an appointment.
Thanks, Doug. And as a quick follow-up, I know late yesterday afternoon, after Mayor Harris made some comments, after Haushalter made some comments, the state health commissioners released a statement saying the stockpile of the vaccine was another significant violation. They called it inappropriately withheld. My question is, has anyone officially responded to Dr. Piercy, responded to the state? Is there any comment to that statement from Dr. Piercy?
Nothing from the city of Memphis. There has been no official response that I know of. Certainly nothing from the city of Memphis. I don't know if Mayor Harris has made a specific response. There is a process that they will go through for the process improvement, as they do in any public service delivery model where there's the aim to improve services. So I'm quite sure if there was a finding of improvement needed, they will have a formal process for responding to the state rather than just trading a statement for a statement.
Kelly Roberts, WMC.
Good afternoon. Some of these questions may just be kind of on the clarification side, but when we talk about the proportioning out of the vaccines and turning it into the state and kind of that regular process, this time around, are you guys saying that you're anticipating more doses to go to hospitals? Do you anticipate the hospitals will soon be able to ramp up their programs for general public vaccinations?
Sure, that's it. So, as I said, it will fluctuate up and down. We are in dialogue with the hospital systems. If you were to ask them collectively, they will say that they are doing the public today. They are partnering with agencies and organizations to do public vaccinations. We have not yet seen a commitment for everyday drive-through points of delivery at the hospitals, but we do know there is planning for some high-volume pods on certain days. So we will apportion it out. The one thing I will tell you is that irrespective of how much we receive, if we receive 13,700 doses, we will apportion that out to partners who can get those vaccines out during that week.
Okay, and my second question, again, is dealing with appointments. I have gotten some emails from viewers with some appointments next week. If people have appointments next week, are those still going to be honored? And when it comes to making an appointment, are you saying that the Shelby.community is still a good place? I know now there are links on the Memphis, Tennessee's website. Where do you think is the best place, that one place that people can get their information, get the latest information about open appointments and sign up for those appointments?
So absolutely. If you have an appointment, we're currently in the process right now of making sure that we understand what all of those appointments were, downloading the file from the Sign Up Genius to make sure that we understand where there were appointments scheduled for next week, and then we will honor those appointments. So our baseline entering next week when we do scheduling is we will lay out the appointments that we know that we have, and then we'll backfill with new appointments on top of that. So yes, we will honor all of those appointments. I will tell you that COVID-19.memphistn.gov is where we will host the Sign Up Genius sites. We are thankful for our partners who are running the Shelby.community site, that they will also have a link on there. So if people are accustomed to going to Shelby.community, they can go there. But as people know, COVID-19.memphistn.gov, we have been keeping up with the dashboard there. And largely we have been mirroring what was on Shelby.community. And so I think either one of those is a good place, but if you want to default to Memphis, COVID-19.memphistn.gov, you can do that. We also, just to be clear, 222 shot will stay the number. We have an agreement to port that over to the city of Memphis, so we won't have to change that number going forward.
Sam Hardiman, Commercial Appeal.
Doug, I have a clarifying question about the stockpile. You said that the 51,000 dose stockpile is now down to about 30,000. Is there a more specific number we can have on that?
No, I'll have to get the inventory specifically. The 51,000, as you know, was what was reported at the beginning of the week. So we have pulled out approximately 18 to 20,000 of those doses to give out on Monday and Tuesday and Wednesday, and now today is Thursday. So over those days, based on the number that we pulled out, I'm giving you an approximate number, Sam, and we anticipate, and that was actually yesterday's number. Today we pulled out another, as you know, almost 7,000 doses. So the estimate was by the end of this week, we will have that down to 10,000. And so next week we'll enter into the week with those 10,000 plus 7,000 that we had received last week. So we'll have 17,000 new first doses. And this Friday, we'll receive 12,870 second doses. That's what we'll be putting out next week. 17,000 first doses, which includes that 10,000 that is what we think will be left at the end of this week. And then the 7,000 that we have on hand, and then the 12,870 second doses.
And as a follow-up, Doug, what steps is the city taking to make sure that it does not thaw too much vaccine so it's at risk of expiring at the end of the day if used?
That's a really good process question, and probably one that I did not. And again, we could stand here all day and talk about the process, and I've learned much more about it in the last 24 hours. But I talked to you about the weekly allocation. Every day at about noon, we will verify and validate the number of appointments that we have the following day at every site. We will also get a good sense of what we think might be left over at each site at the end of the day. Unfortunately, we do our best to schedule, and Health Department did their very best up to this point scheduling appointments, but some people just do not show up. So that means there's always a few left over at the end of the day. By about noon, we'll get a pulse on where that is and how we think appointments are going. We'll make an estimate on the number that we think might be left over at the end of the day. We'll look at the number of appointments we have scheduled for the following day. And then before 2 o'clock, we will let our partners at Regional 1 in the pharmacy know, we'll let them know, here's the number of doses that we will need for tomorrow. They will take them from the freezer, put them in a refrigerated area so that they can come to temperature. And that's our best estimate on how we will thaw the doses for the following day.
Greg Akers, Memphis Business Journal. Greg, I think you're muted.
Sorry about that. Hi, Chief McGowen. What happened last Friday where it was said that restaurants that were MLGW customers were going to have to close due to water issues, and then when the release of the health directive came out at 2 p.m., it said that they could stay open if they followed the boil water protocol?
Well, David could probably answer that if there is an internal question. I think the important thing was, first, it was clarified that restaurants could stay open if they could boil, but more importantly to me is today at 3 o'clock, MLGW will be having a press conference, and at that time we expect to get some news about the boil water advisory. So I have no inkling of what they might say, but I do know that we'll get an update on the status today. David, anything to clarify?
Thank you for the question. And last week, when we initially got notification from MLGW about the boil water notice, there was an initial, the health directive was still being written at the time the press conference was going on. So part of the disconnect is that we were talking in generalities at the time of the press conference, but during the subsequent hour, the final wording of the health directive was solidified. So if there was a slight change in nuance or a point of emphasis there, that's where the confusion, I guess, was introduced. But as the health directive went out, that's the part that is the official document, right? That's the official statement. And in that official statement, we clarified that if a restaurant or facility could abide by MLGW's boil water advisory, then they could operate. But if they could not abide by the boil water advisory, then they needed to close. That's the official standing, and that's what it turned into. But I know there was some slight confusion there, but I don't think it was intentional in any way. But thank you for all your interest. Mayor Strickland, do you have any closing remarks, or Doug?
Sure, I'll close it out by saying an answer to your earlier question, one other change we'll make, particularly at Pipkin, but all locations. We will gather your information before you get into the building, while you're in line when we check your appointment card. That will speed up the process, and that has worked really well this week at Pipkin, and that alone, along with the other two rules. We're in this together. Our goal is to put as many shots in your arms as we possibly can within weeks. This community is going to start getting 40,000 doses per week, 50,000 doses per week as J&J comes online and these other manufacturers give us more supply. We're going to be prepared to handle that volume. Thank you.
Thanks, everyone. Have a great weekend, and we'll see you back here on Tuesday.